Have you ever paid attention to what your body is trying to tell you when you wake up in the morning? Not the obvious aches or persistent coughs, but the subtle signs, so small that they're easy to overlook. Many older adults believe that waking up feeling tired, forgetful, or disoriented is just a normal part of aging. But sometimes, those seemingly ordinary symptoms are actually the body's first warnings, signals of an illness quietly developing beneath the surface. What's concerning is that many people, perhaps you, your loved ones, or even our own parents, are living with these signs every day without realizing it. And as a result, it's only when the symptoms become severe that the chance for effective treatment begins to decline. The good news, however, is this. You can absolutely recognize and respond early, just by paying attention to yourself in the simplest moments, like when you wake up each morning. This article will highlight 8 important signs that older adults should pay special attention to each morning. Indicators that may be related to cancer, hormonal disorders, or other serious health conditions. At the same time, you'll also learn small but effective adjustments to better care for yourself or an aging loved one. If you find this article helpful, don't forget to share it with your family, because who knows, one small action today could change someone's entire health journey tomorrow. Have you ever experienced any of these signs? Share your thoughts in the comments below, so we can learn and listen to one another. Now, let's explore the 8 early morning signs you should never ignore. Have you ever woken up in the morning with a heavy head, as if you'd just weathered a storm in your sleep? You might think it's due to poor sleep, overthinking, or simply a change in weather. But if those headaches persist and keep coming back, it's time to give them the serious attention they deserve. Have you ever asked yourself, why am I having so many headaches, even though I get enough sleep, eat well, and don't feel overly stressed? Many older adults tend to dismiss headaches, assuming they're just a natural part of aging. But in reality, chronic headaches can be an early warning sign of more serious health issues. They may be the initial symptom of cerebrovascular disease, one of the leading causes of stroke. They might also be the result of cervical spine degeneration, a condition common among older individuals, especially those who used to work office jobs or lead sedentary lifestyles. Moreover, dull, ongoing headaches can be linked to anxiety disorders or depression. Illnesses often overlooked in seniors because people usually focus only on physical symptoms. The good news is, persistent headaches can be managed if you proactively listen to your body and take timely action. Instead of silently enduring the pain or relying solely on painkillers, you can start with simple yet effective ways to ease the discomfort. For instance, drinking a warm cup of ginger tea each morning not only improves blood circulation, but also helps calm the nerves. Before bed, soaking your feet in warm water with salt or peppermint oil can relax your entire body and improve sleep quality, an important factor in preventing headaches. In addition, maintaining proper posture while reading, watching TV, or using a phone can reduce pressure on the neck and shoulders, 2 common sources of mechanical headaches. With consistent and proper care, headaches can noticeably subside, and you'll begin to feel a positive difference in your quality of life. Making small habit changes, like staying hydrated, eating a nutritious breakfast, and doing light morning yoga stretches can create a significant impact. On top of that, don't skip regular medical checkups, especially if the headaches come with symptoms like blurry vision, loss of balance, or slurred speech. Small adjustments today can help prevent serious consequences tomorrow. Start by listening to your body each morning. The next time you wake up with a headache, don't just reach for a pill and move on. Take a moment to ask yourself, what is my body trying to tell me? It might be a call for rest, or a sign of something more serious that needs early attention. And now that you know headaches are more than just ordinary fatigue, let's move on to the next sign, a symptom just as common: joint pain, a silent warning about your bone health. Have you ever found it difficult to get out of bed in the morning? Every movement, every step feels like something is pulling you back. Not sharp pain, but a dull, lingering discomfort that makes you hesitate to move. For many older adults, this is a familiar experience, so common that they consider it a normal part of aging. But is joint pain really something we must endure every day, or is it a cry for help from our body? According to data from the CDC, millions of Americans aged 60 and over are living with undiagnosed musculoskeletal conditions. Joint pain is not simply a sign of wear and tear. It can be an early indicator of more serious issues, such as autoimmune arthritis or even bone tuberculosis, a bone infection that's quietly re-emerging among seniors with weakened immune systems. More worryingly, if not detected and treated early, joint pain can lead to joint deformity, loss of mobility, and a serious decline in quality of life. The important thing is, you can absolutely reduce pain and keep your joints healthy, starting with simple actions. Instead of sitting still and enduring it, or relying entirely on medication, you can combine various natural home remedies to ease joint pain. One of the easiest methods is applying a warm compress in the morning. Gentle heat helps soften the connective tissues around the joints, relieving stiffness and pain. You can also add a few drops of peppermint or ginger essential oil to the warm water for enhanced relaxation. In addition, doing light stretching exercises like Tai Chi, yoga, or indoor walking with supportive shoes can help lubricate the joints naturally. When you begin to take proper care, your joints will thank you with increased flexibility and ease each day. Maintaining a routine of moderate movement is key to joint protection. Don't wait until you can't walk anymore to start exercising. Just 15 to 20 minutes of light activity each day is enough to make a difference. At the same time, be sure to include joint-friendly foods in your diet, like salmon, walnuts, leafy greens, and various seeds. If joint pain lasts more than 2 weeks or is accompanied by swelling or redness, seek medical attention early to identify the exact cause and avoid unwanted complications. No joint ages overnight, but neglect can speed up the process more than you think. Taking care of your joints each morning is how you actively protect your independence in the future. A strong pair of legs doesn't just help you take morning walks, it symbolizes freedom, autonomy, and the joy of living in old age. So go ahead, apply that warm compress, stretch gently, and take another step. You'll feel the difference today. Next, we'll look at a silent but deeply impactful sign: fatigue and memory decline. Subtle but essential to recognize. You wake up after a full 7 to 8 hours of sleep, yet still feel tired, foggy, and unfocused. Have you ever walked into the kitchen to grab something, only to forget what you were looking for? These experiences are not just signs of aging. They can sometimes be early warnings from within your body. Have you ever wondered, is persistent fatigue and memory decline truly normal? Many older adults experience chronic fatigue or frequent forgetfulness without realizing that these could be signs of more serious health problems. Among the most common causes is thyroid dysfunction, especially hypothyroidism, which affects around 1 in 20 seniors but often goes undiagnosed. Type 2 diabetes can also impair cognitive function if not properly managed. And we must not overlook depression, an invisible but widespread condition in older adults that often shows up not as sadness, but as prolonged fatigue and a lack of interest in daily life. The good news is, no matter the cause, you can manage this condition with proactive habits and a deeper understanding of your body. Start with small changes in your daily routine. Drinking a glass of warm lemon water each morning helps detox the liver, jumpstart digestion, and wake up your internal organs. Eating a nutritious breakfast, rich in B vitamins, protein, and fiber, provides stable energy for the brain throughout the morning. Sticking to a consistent sleep schedule, even on weekends, improves sleep quality and helps regulate your body's internal clock, leading to reduced fatigue and clearer mental focus. Small habits can lead to major changes, and you can begin today. No complicated or expensive interventions are needed. Just prioritize self-care. Avoid staying up late, reduce sugar intake, do light stretches upon waking, and allow time to unwind before bed. If fatigue or forgetfulness lasts more than 2 weeks, see a doctor. A basic blood test or thyroid hormone screening can be a simple yet vital step to detect underlying issues early. Your body is speaking. Listen before its message becomes a late warning. Many people mistakenly think that rest is enough. But if fatigue doesn't go away, despite proper rest, it's time to take action. There's nothing more alarming than gradually losing your ability to remember, understand, and connect. The very things that define your identity and quality of life. Caring for your mental health is just as important as caring for your physical health, especially in later years. A sharp memory and a healthy mind aren't out of reach. They begin with how you treat yourself each morning. Hydrate, eat well, sleep enough, breathe deeply, and be patient with yourself. And now that you've learned how to recognize and respond to fatigue and memory decline, let's continue this health journey with the next sign: wheezing and phlegm, warning breaths from your lungs. In the morning, you wake up with a wheezing breath, as if something is stuck in your throat. You have to clear some phlegm just to feel more comfortable. It's probably the cold air, you think. But if this keeps happening day after day, especially when you're not sick or allergic, then it's no longer something to ignore. Have you ever wondered, what is my breath revealing about my lungs? Chronic respiratory conditions such as asthma, chronic obstructive pulmonary disease, COPD, chronic bronchitis, and even lung cancer are becoming increasingly common, especially among those over 60. What's concerning is that the early symptoms of these conditions, wheezing and phlegm, are often dismissed or mistaken for a common cold. For those who have smoked, been exposed to dust, or lived in polluted environments, the risk of serious lung disease is even higher. But here's what you need to remember. Every breath matters, and it can be improved. If you often experience wheezing or phlegm, start by improving your living environment. Use an air purifier. Maintain optimal humidity with a humidifier, especially during dry winter months. Drinking warm water with honey in the morning can soothe your throat, loosen phlegm, and make breathing easier. You can also steam your nose and throat with eucalyptus or peppermint essential oils to help clear your upper airways. These small steps can make a noticeable difference if practiced consistently. Clean air begins with the space you live in and how you care for every breath you take. Beyond purifying your environment, take care of your body from the inside. A diet rich in antioxidants, such as leafy greens, berries, tomatoes, and salmon, can strengthen your lungs' defenses. Deep breathing exercises and light movement such as walking 10 to 15 minutes each morning, help air circulate more efficiently in your lungs, reducing congestion and wheezing. And if your symptoms don't improve after 1 to 2 weeks, don't wait, see a doctor. Especially if wheezing is accompanied by a persistent cough, shortness of breath, unexplained weight loss, or coughing up blood, you need to consult a respiratory specialist immediately. Early detection of lung cancer or chronic respiratory disease plays a crucial role in treatment success and quality of life. Breath is life, and you deserve to live each breath with ease and comfort. Many people only begin to appreciate breathing when they start losing the ability to breathe normally. Don't wait for that moment. Each morning, observe how you breathe. If anything feels off, take action and listen to your body. It's not just about protecting your lungs, it's an act of self-love every single day. Now take a deep breath and get ready for the next health signal in our journey: loss of appetite, the quiet whisper from your digestive system. You sit at the dining table, looking at a familiar dish you used to enjoy. But today, after just a few bites, you put down your chopsticks. Not because you're full, and not because the food tastes bad, simply because you don't feel like eating. And this keeps happening, day after day, leading to unexplained weight loss. Have you ever considered that a loss of appetite might not just be indigestion, but an internal signal that deserves attention? In older adults, loss of appetite is one of the most commonly overlooked symptoms, yet it carries serious health risks. This condition can result from gastric ulcers, fatty liver disease, or more seriously, it could be an early sign of stomach or esophageal cancer. In addition, certain metabolic disorders, depression, or long-term use of medications, such as painkillers or anti-inflammatories, can also impair taste and reduce appetite. The good news is, you can absolutely regain your appetite if you understand the cause and act early. Instead of forcing yourself to eat a large meal when you're not hungry, start your morning with a light, appetite-stimulating breakfast. A glass of fresh orange juice, a slice of whole grain bread with nut butter, or a warm bowl of porridge with fresh ginger. Simple, easy-to-digest foods with pleasant flavors can help wake up the digestive system after a long night. You can also use natural ingredients that boost appetite, like pineapple, mint, or warm lemon water with honey before meals. Appetite doesn't come from fancy meals. It comes from a body that is gently supported in the right way. Maintain regular meal times and create a pleasant dining environment, such as playing soft music or using brightly colored tableware to uplift your mood and make meals more appealing. Light physical activity before eating, like a 10-minute walk around the house, can improve circulation and stimulate natural hunger. Most importantly, avoid eating alone if possible. Sharing meals with family, neighbors, or friends is a wonderful way to connect and rekindle interest in eating. If your loss of appetite lasts more than a week, or you experience unexplained weight loss, see a doctor. Basic tests such as abdominal ultrasound, endoscopy, or liver function screening can help detect early internal issues. Especially for older adults, malnutrition due to poor appetite can lead to complications like weakened immunity, osteoporosis, or cognitive decline, all of which can be prevented with timely intervention. Enjoying food is one of life's simplest pleasures and a sign of a healthy body. Pay attention to your appetite the same way you monitor your blood pressure or heart rate. Every time you lose interest in eating, ask yourself, what is changing inside my body? And listen, make gentle adjustments before it becomes a bigger problem. Now that you understand that appetite loss isn't just about digestion, let's continue identifying other important health signs, starting with one of the most commonly overlooked symptoms: blood in the stool. On an ordinary morning like any other, you go to the bathroom and suddenly notice blood in your stool. It might be bright red on the toilet paper, or darker and mixed into the stool. You reassure yourself, it's probably just constipation or something I ate. But then it happens again, and you start to feel concerned. Have you ever thought blood in the stool might not just be a temporary issue, but a sign of something more serious? Blood in the stool is one of the earliest symptoms, and yet one of the most frequently overlooked, especially among older adults. The cause might be something relatively minor, like hemorrhoids or anal fissures from chronic constipation. But it could also be a sign of colon polyps, benign growths that can turn cancerous if left undetected. In more serious cases, it may even be an early warning of colorectal cancer, a condition that's on the rise among the elderly. However, what you need to remember is this: early detection is key to prevention and effective treatment. If you notice blood more than once, don't delay. Seeing a gastroenterologist for a colonoscopy is the safest and most accurate way to determine the cause. In addition, a fecal occult blood test, a non-invasive and simple screening, can help detect early signs of colorectal cancer. The earlier the detection, the higher the chance of successful, less invasive treatment. You can also support your digestive health through everyday habits. Start by drinking enough water each day, at least 6 to 8 glasses, to prevent constipation. Eat plenty of leafy greens, fresh fruits, and fiber-rich foods like oats, chia seeds, and legumes. Most importantly, maintain a regular bowel routine by going at the same time each day to keep your intestines functioning smoothly. Light daily exercise for 15 to 30 minutes, even just walking around the house or doing simple stretches, can also help stimulate bowel movements. Listening to your digestive system is a way of listening to your overall health. Don't let embarrassment or complacency cause you to miss the golden window for addressing a problem. If blood in your stool is accompanied by unexplained weight loss, loss of appetite, persistent diarrhea, or dull abdominal pain, seek medical attention immediately. Taking action today can save you from unwanted surgery or costly treatments in the future. Using the bathroom is a daily routine, but what you see there could save your life. Each morning, take a minute to observe and listen to signals from your digestive system. Don't ignore them. Don't be embarrassed, because this is one of the simplest ways to take control of your health. And now, as you better understand this silent but serious warning sign, let's move on to a symptom that seems minor but may point to deeper internal issues: a bitter taste in the mouth. You wake up with a bitter taste on your tongue, as if you just drank a strong cup of coffee, even though you haven't eaten anything. Throughout the day, your mouth feels dry, your sense of taste is dulled, and food becomes difficult to swallow. You tell yourself, maybe I just ate too much last night. But if this sensation keeps recurring, it's time to pause and pay closer attention. Have you ever thought, a bitter taste in the mouth isn't just a passing feeling, but possibly a reminder from your liver, kidneys, or digestive system? A bitter taste in the mouth is fairly common, but rarely treated as a serious issue. However, it can be an early sign of several underlying health problems, from liver conditions like fatty liver or chronic hepatitis to kidney issues, gastroesophageal reflux disease, GERD, or even type 2 diabetes. When detoxifying organs, such as the liver and kidneys, don't function efficiently, toxins can build up in the body, directly affecting your sense of taste, leading to bitterness, dry mouth, or persistent bad breath. That said, you can significantly improve this condition if you know how to adjust properly. Start by improving your oral hygiene. Brush your teeth thoroughly twice a day. Use dental floss and rinse with saline water or peppermint mouthwash. Sometimes, bitterness is simply caused by plaque buildup or a mild oral infection, something that can be resolved with proper care. Next, adjust your diet. Reduce fried foods and processed products, and increase your intake of leafy greens and fresh fruits, especially those rich in antioxidants like apples, grapefruit, oranges, and cucumbers. Bitterness will gradually fade as your body gets cleansed from the inside out. Certain herbs can also support liver and digestive health, such as artichoke, milk thistle, ginger, and peppermint tea. Drinking a warm herbal tea after meals or in the morning can help boost circulation and aid digestion. Also, don't forget to manage stress. Chronic stress disrupts the autonomic nervous system, often leading to acid reflux and digestive issues that impact taste. If the bitter taste persists for more than a week, seek medical advice to rule out underlying conditions. Simple blood tests can help assess liver, kidney, or blood sugar function, allowing doctors to recommend appropriate treatment. Don't wait for additional symptoms like skin rashes, jaundice, dark urine, or unexplained weight loss to appear before taking action. Early detection is always the most effective medicine. Don't underestimate a sensation, because sometimes the bitterness in your mouth is your body asking to be healed. When you enjoy food and fully savor flavors, it's not just a pleasure, it's a sign your body is functioning well. So don't overlook the smallest signals. Listening and adjusting in time is one of the most proactive and effective ways to care for yourself. Next, let's look at a very common but often overlooked symptom, especially in the morning: a persistent cough. Could it just be a reflex, or is it a sign of something deeper? In the morning, you open your eyes, and the first thing you do isn't stretch, but cough. A dry, lingering cough lasts several minutes, leaving your throat sore and your chest tight. You rush to find a glass of water or your usual cough syrup. It's probably just the dry air, you think. But the next day, and the day after, that same cough returns, like an unwelcome habit. Have you ever wondered, why do I keep coughing every morning, even when I don't have a cold or the flu? Coughing is a natural reflex that helps the body expel irritants, mucus, or bacteria from the respiratory tract. However, a persistent morning cough can be an early sign of chronic respiratory illness. Ongoing coughing is often associated with chronic bronchitis, asthma, or more serious conditions such as COPD, chronic obstructive pulmonary disease, and lung cancer. People who have smoked, lived in polluted environments, or been exposed to toxic fumes over time are at higher risk. But what you need to know is this: coughing isn't a destiny of aging. It's your lungs reminding you to take better care of them. Even if your cough isn't accompanied by fever or shortness of breath, a recurring morning cough is a sign worth your attention. Simple steps can help ease the symptoms. Keep your neck and chest warm while sleeping. Use a humidifier in your bedroom to prevent dryness in the airways, and drink warm water with honey each morning. Honey has natural antibacterial properties and is highly effective in soothing the throat. Additionally, inhaling steam with eucalyptus or ginger essential oil can help clear nasal passages and loosen phlegm. improving a morning cough. When you care for your lungs through healthy habits, the cough will gradually subside and breathing will become easier. Maintaining clean indoor air is essential. Avoid cigarette smoke, fine dust, and irritants like air fresheners or harsh cleaning chemicals. If you still smoke, it's time to seriously consider quitting. It's never too late to let your lungs breathe freely again. Studies show that quitting smoking can improve lung function within weeks and significantly reduce lung cancer risk within a few years. If your cough lasts more than 3 weeks, seek medical attention, especially if it comes with fatigue, wheezing, or coughing up blood. A simple chest X-ray or CT scan is often all it takes to detect early lung issues. Early treatment is far less invasive and more effective than treating advanced disease. Coughing is your lungs trying to talk to you, and each cough is a chance to listen. Don't let coughing become a lingering worry. Take early, gentle, and consistent action each day by protecting your airways, soothing your throat, and paying attention to the air you breathe. And now, before we move on to the final summary, let's take a moment to review the healthy morning habits that can help prevent all the warning signs we've just explored. Starting from the smallest daily actions. We cannot control time, but we can control how we begin each day. For older adults, the morning is more than just a starting point. It is a precious opportunity to observe the body, listen to its quietest signals, and take timely action to preserve health. Here are a few simple habits that can have a powerful impact on your quality of life. Drink a glass of warm water upon waking. It helps cleanse the digestive tract, activate digestion, and wake up the entire body. Do some gentle stretching exercises. Light movements like stretching your limbs, rotating your neck and shoulders, or walking around the house for 10 minutes can improve blood flow and reduce joint stiffness. Eat a nutritious breakfast on time. Prioritize foods that are easy to digest and rich in fiber and protein, such as oats, boiled eggs, fruit, or plant-based milk. Establish a regular morning bathroom routine. Don't hold it in and don't rush. Consistent bowel movements help maintain digestive health and reduce the risk of constipation or hemorrhoids. Keep a calm and peaceful mind. Try light meditation. Take 5 deep breaths or listen to calming music to begin the day with inner peace. Massage your head and face. This stimulates blood circulation to the brain, supports memory, and eases tension-related headaches. And most importantly, don't skip routine health checkups. Visit your doctor as soon as you notice any unusual signs. Delayed responses are often what turns small problems into serious conditions. A simple annual checkup or blood test may be the critical barrier between wellness and illness. Above all, remember this: good health is not a matter of luck. It is the result of choices repeated each day. And every morning is a new chance to choose what's right for you. Thank you for taking the time to be here with me. In a fast-paced and ever-changing world, the fact that you've paused to truly listen to your body, especially in the morning, is both admirable and courageous. Because taking care of your health is never easy, but it is always worth it. Today, we've walked through 8 important signs that may appear each morning, from headaches and joint pain to fatigue, and even quieter warnings like blood in the stool or a persistent cough. Each of these signs is a valuable clue your body sends, not to frighten you, but to help you act early, take control, and live with greater peace of mind. What did you learn from these reflections? Was there something that made you pause and realize something deeper? Are you currently facing one of the signs we've discussed? Share your thoughts in the comments so we can learn from one another and offer support. No experience is too small. Sometimes your story could change someone else's life. If you found this content helpful, don't hesitate to hit like and share it with friends or loved ones because someone else may need it more than you realize. And if you'd like to receive more content like this, be sure to subscribe so you don't miss future updates. We hope to walk with you, not just today, but throughout your long-term journey toward better health. Because you deserve to live with vitality, peace, and the freedom to choose how you want to live each day. Living a healthy life doesn't require anything grand. It simply starts with tuning into your breath, your heartbeat, and how you feel every single morning.